So Lisa is now saturating a rough gauze with the prep solution to properly degrease the skin and prepare it for the peel. And she's using a pretty firm motion because, again, a properly degreased skin is a wonderfully applied and even peel with no hot spots, no areas of pooling, so we don't create any crusting or areas that the solution didn't travel to, for a very, very even peel. So we know that the glycolic retinol solution is a much stronger peel. It has a much lower pH. The molecules are much smaller than vitamin C, so she's going to feel some immediate start on the forehead and work in a circular motion again. And she's going to apply it for 1 minute. It takes about 30 seconds for kind of the sensory nerves to kick in to where she starts feeling some activity. After about 20-30 seconds, it shoots up pretty quickly. So we're going to apply it for 1 minute, and then we're going to massage for a minute. But clinically looking at her skin, erythema, she's about a 5. She went from a 0 for very little redness to a lot of redness. So that tells you a couple things. First, Patrice has a high tolerance for this activity level. That's one thing, because she's very red, but she's not feeling it. And number 2, her skin is in very good health, meaning that there's already a lot of redness and inflammation, so the peel's gone very quickly, very fast. If you have someone with very leathery, really wrinkled skin, smoker skin, really heavily sun damaged, they may not feel anything right now. Because that stratum corneum is so thick, it's going to take a long time to get down to where the dermis and the blood vessels are to see some inflammation. So with the level 2 peeling, she's going to see anywhere from 1 to 4 days of light to moderate peeling. On a level 1 to 10, what is she peeling?
2, 3.
About a 2 or 3. So with this particular client, if this wasn't a demonstration, we would probably continue to leave this on at least 5, maybe 6, maybe 7 minutes. She's not feeling much activity. She's already been prepped for the skin. And you know with a level 2, she wants a nice treatment. But when you start applying the wet sponges, you may feel a slight increase. Is that correct?
Correct.
Yes. Because with the sponges and the water, initially it somewhat pushes the solution deeper, but then the water neutralizes the acid and it completely... Very good question. Do you actually see the peeling in the skin? Because of these acids, you will actually not see the peeling for 1 to 3 days. Because the solution has to do its work. It creates an exfoliating mechanism on that lower layer, which sheds all of the old skin off. And that's why it's called a peel. So you won't see any initial peeling. Only after 48 hours. But that's the beauty of this post-treatment kit, because it has that enzyme mask. When you feel that amount of peeling, then you can use this mask, and it just eats it up and removes all the dead skin cells. So it's a really, really nice combination. Okay, the other thing with level 2, in addition to the enhancers, is next, after we removed it, we mix 2 drops of the retinol with the retinol cream. So what does this do? They're getting a peel within a peel, and that's why it's level 2. You've applied a 40% solution. Now you're applying a vitamin A derivative along with 25% retinol that's going to enhance the peeling process of this particular treatment and really begin that exfoliation process. So this is what separates level 1 from level 2, is customizing the enhancer and the retinol cream. Next is the Vital C eye gel for hydration and vitamins around the eye area. And the last is the organic sunblock. So the question was, could you leave it on the entire time? Yes. And remove it, you take those same sponges, you just remove it, and in the treatment protocol, then you apply our Total Repair Cream, like a hand cream, and then our hand cream that has a sunblock.